research group. Next month we have a very interesting seminar on return on investment with Jose Diaz from here at Wilder. So that'll be a good session. That's our December session. But for November, we've got race and class disparities in DEED's workforce system. We've got two analysts, performance measurement and performance measures analysts, Ellen Bendwald and Scott Godfrey from DEED. They're in the performance management team at DEED. Ellen holds a master's degree in public policy from the University of Minnesota's Humphrey School and a bachelor's degree in economics from Macalester College in St. Paul. And Scott holds a master's degree in political science from Kansas State University in Manhattan, Kansas, and a bachelor's degree in political science and social studies from Bemidji State. So thank you, Scott and Ellen.
Thanks, Neil. Thanks for having us present to you. This is a project that Scott and I worked for months on, so it's nice to present it to a group of a lot of strangers. So our agenda for this hour is I'm going to talk a bit about the project background and sort of the lay of the workforce development system land. And then we're going to launch into methodology and results. So Scott's going to talk about the counselor survey, and I'll talk about the and the administrative data analysis we did. And then we're going to talk about our two sort of final products, which is the report on disparities and then a web tool that explores what works in workforce development. And we're going to leave some time at the end for questions, but feel free to ask your questions as we go, and we will take this. So this whole project was funded by the Job Skills Partnership Board, which is a board under sort of DEED auspices that oversees a few workforce development programs and also oversees the state dislocated worker program. And so they're very involved in the workforce development team. They have been interested for like a year running up to this project on data on racial disparities, especially among dislocated worker participants. And so our team sort of proposed a couple of projects to look into that more. And so they accepted our proposal and we got to work. These are sort of the two things that they told us to do. So conduct a study on minority job seekers and then build a tool that explores what works. So our proposal to the board, especially on the disparities project, was pretty open-ended, and there was a lot of, I mean, you could take it multiple different routes, and so at the same time that, like, we had just gotten this funding and DEED hired a couple of community outreach staff to sort of reach out to nonprofits serving communities of color. And so that was sort of becoming a larger focus, at least in workforce development. And so we worked with them to sort of make sure that the research that we were doing had relevance to their work so that someone could actually use the research, because of course we don't want to do all this and then not have anyone look at it or use it. And I guess, so our research team is under a different area. Like, we don't really do program administration, so we're not always sitting in on specific like policy discussions. So we don't always know the impact of our research, but I guess we've heard enough like requests for this report that I think we can say that at least some people are reading it and listening to it. So we're sort of counting that as a win so far. So the audience for this project is largely the workforce development community. and our goals was to do a few things. So provide transparent data on disparities among program participants, which we know is sort of a request that has come from other groups working on disparities issues, is like, we need more transparent data on this. So that's partly something we wanted to do with this report. We also wanted to go beyond the data and collect new data, talk to people in a way that our team doesn't usually get to do. And Scott's going to talk more about that. So to provide more context on the disparities that we're seeing. And then finally, we wanted to also bring in other policy reports and recommendations from this area on what you should do about this problem, and sort of simplify that with what we were hearing from workforce development professionals that we talked to as well. Just a side note on programs before launching into this. So we sort of have this general title of Race and Class Disparities in Dee's Workforce System, but we should clarify that we're looking at adult workforce development programs, and within that area, so we're not looking at youth workforce development programs, we're not looking at vocational rehab, and within the adult workforce development sort of sphere, we are looking at dislocated worker, WIA adult, federal adult, which is now WIOA adult, and then the state-funded adult workforce development program. So, yeah. And with that, I think we're going to launch right into our methodology section. So first I'm going to talk about the administrative data that we looked at for this project. So this is sort of our wheelhouse, and this is what we do a lot. We also do a lot of surveys. We don't do a lot of interviews, so that's sort of the new thing with this project. So for the administrative data, all of our participant data is tracked in Workforce One, which is a sort of client tracking system. So everyone in dislocated worker and adult programs, all of their demographic information is collected here. All of the program activities that they're engaged in. And we combined that with employment data from UI's wage detail. And some of you may know that better as the data that feeds into QCEW. So this is all of the reported employment in the state, and we link that up to our participants to see whether they're working or not, how much they're earning, how many hours they're working each quarter. And we also looked at cost of living data to so we looked at race and class disparities. The way that we define class is, did you earn enough to meet your cost of living in the previous year? And so the cost of living is defined by the Labor Market Information Office, and they have a very rich methodology for how they come up with these estimates. And it's broken out by county, by the number of earners in the household, the number of children in the household, whether the adults are over 55 or not. I think that's it. So we sort of linked up those demographics to our participant demographics, kind of check, like, did they meet their cost of living? And if they did, we called them higher class, and if they didn't, we called them of a lower class. So to just talk about some of the results that we found that are in the report, this is the employment status of adult participants. So I've never used a pointer before, so this is going to be fun. So we have the employment status by race up in these top two graphs, and then employment status by class. So were they financially struggling? Were they financially secure? Is sort of the intuitive shorthand that we used for class. This is probably really hard to see, but the dark green is full-time employment, the light green is part-time employment, and then the dark blue is no work at all. And this is based on the hours data in wage detail. And then this side of the graphs are before enrollment, and then this side is after they exited the program. Like, this is just summary statistics. It's not like we're not doing a regression or anything here. So this is just what the data are saying. Adult, we've separated out adult and DW because they're very different populations. So if you look at this one, there's almost no blue on there because by definition a dislocated worker was working before they enrolled in the program. And so it's a very different subset of people than those who are served in the adult population. So just to make that point. But
what's the gap in employment? So, I mean, a dislocated worker isn't working often when going into the program. They had worked within, how much time did you give?
Had in 4 quarters.
4 quarters.
Prior to. And this, so we looked at, I think I gave them a quarter buffer zone.
Okay.
So like 2 to 5 quarters out. On average, over that time period, their full-time or part-time status? Yeah, good question. So this is, I defined full-time as 35 hours per week. And so I summed up all of the hours worked in the year. And if that came out to equate to 35 hours per week, I counted that as full-time. So they may have worked, you know, really a lot of hours in 1 quarter and then on part-time in another quarter, but we're not really seeing that. All of our wage information is only by quarter, and so we don't really see weekly statistics. So this, we also looked at the amount that they earned. This is dark green, so it correlates to, it's only those who worked full-time, to sort of separate this difference between, like, obviously you're going to earn less if you're only working part-time. So we wanted to separate out the wage disparity from the employment disparity. And so this is again by race and then by class. Yeah. This is a box plot, so the green is the middle 50%. The middle bar is the median earning, and these are earnings over the year. Yeah. So this is the same thing for a dislocated worker. Like I said, there's very few dislocated workers who were not in wage detail at all before they enrolled. I guess I should note that not everyone is in wage detail. There's like 3% of employment in Minnesota is not covered by wage detail. They may also have worked in a different state, and so that's sort of why we would see folks with no work in that program.
What are the years that are being captured here? I missed it.
I didn't say that. I'm not remembering off the top of my head.
I'm just thinking that depending on what years these are, we just have a very large population of long-term unemployed and dislocated workers that haven't worked within that year,
yeah,
but are still in the program, and therefore you know,
Yeah.
looking at this over time, you might see that blue in dislocated workers grows and shrinks depending on.
Yeah, that's a very good point. Yeah. I'm not, I think, so to get the detail for all of the racial categories that we had to combine multiple years.
Right.
And then to look a year out, we had to look a year out for outcomes. We had to go back a year. So I think it's like 3 years grouped together. So maybe that's an extra question that I will.
You know, like 12-13 or 12-13.
I can definitely
I can't remember.
find that in the
No,
report.
I wanted that the answering of the 3 years going back
Yeah.
means you're capturing the long-term unemployed in my question, which
Yeah.
is those folks still not getting in after the recession.
Mm-hmm. Yeah. Good. And then we have the same thing for dislocated worker. So again, this is only people working full-time, before and after. So not a huge amount of change, but we're just sort of laying the data out there. And I'm sure people have seen charts like this before. For, I guess the focus here obviously is program participants. So we're capturing a small slice of people in the state who are unemployed or job seeking or needing help with that. So we tried to do some new and fun things with the data that we don't usually look at. So we do capture a lot of demographic variables in our participant data that we don't tend to bring out for sort of performance analysis. So this shows whether the person has limited English skills. And so that is determined by the counselor. There's not like a state policy on what that means. So it could be that local areas may have different ideas on what counts as limited versus doesn't. But this is sort of the data that we have. Obviously, very different by race. What we're only starting to collect now is immigration status. So we could also soon show immigration status along with this. But sort of the motivation behind digging deeper into this data is to provide more quantitative context for the disparities that we're seeing, and sort of motivate what local areas, what strategies they're already using around disparities. So this middle row is Asian or Pacific Islander, and in both dislocated worker and in adults, they have the highest rates of limited English skills. So this shows educational attainment among adult program participants. So on this one, we sort of break it out by age categories as well to sort of show, obviously, we'd expect younger people to maybe not be done with their education yet because it's sort of a lifelong thing. And so we wanted to break that out by age to sort of not control for that, but look more closely into that. And so we have that again by race and by class. I think an interesting thing here is, so this dark green is less than high school diploma or GED. We sort of see the same pattern among Asian or Pacific Islander and like Hispanic or Latino and Black or African American as we saw on the limited English side. So that sort of suggests that maybe those are both being influenced by immigration status. I should say that race in our data, participants are asked to self-identify which race and ethnicity they identify with, and they can choose multiple races. There are not enough of people who choose multiple races to show in this report, just because the sample sizes are too small, but they are also out there. This is sort of the same chart for dislocated workers. So it's a lot more blue and a lot less green. Blue is higher educational attainment. So just more context around that program. It's sort of capturing more of a slice of Minnesota, while the adult program is really targeting low-income participants. So this was another thing that we sort of did for the first time with this report, is family composition. So we asked participants, did they, how many dependents they have and their family size. And so with those two pieces of information, sort of calculate how many parents are in the home as well. So we did that because in our conversations with other folks at DEED, it's obvious that a key sort of determinant of how well someone is going to do in the program is how strong their social network is and their social support. And that can be like literally like financially supporting someone, or it can be like a job network sort of support. And so we don't have information on like any other social support, but we do have information on their family. So sort of pulled that out for this. So I'm just going to breeze through some of these because they're small and in the report, which I will point you to. But finally, we did look at some program activities. So this is training completion by race and class. So green is successfully completed any type of training. So that could be like a training program at NISCU, or it could be an ESL class. Like we're taking a really broad definition of training for both dislocated worker and adult again.
And you're saying a counselor said you finished it, not earned a certificate in this case?
Right.
Okay.
Right. Yep, the light blue is counselors said they didn't complete, and that's a very small portion. Yeah, with that, we'll talk about the survey.
Thank you. Okay, so as Ellen alluded to earlier, we sort of had these two mandates from the MJST board that were somewhat amorphous. And Ellen did us a favor early on by coming up with a very succinct way to think about what we needed to do. And that was that she said that we have this program data, the Workforce One data, and we have wage data. And they can tell us what disparities are persisting, but they can't tell us why. And so the decisions that we made moving forward in the interviews that we conducted were to try to find that contextual knowledge about why are these disparities persisting. In order to do that, we identified two groups that we wanted to interview, one of which were employment counselors. And we defined employment counselors as people who regularly provide ongoing one-on-one employment counseling to job seekers from the programs that Ellen mentioned and outlined before. It sounds kind of simple, but the problem is there is no list of all the employment counselors in the state of Minnesota. So what we did have is in our content management system, Workforce One, is we have staff that are listed and they're flagged as different roles for each of the programs or agencies that they work with. So we went in and we found what are called case managers. That was the title that best matched what we were looking for. And we pulled 427 of them that were tied to the programs or agencies that we wanted to work with. And we contacted all 427 and we asked them to confirm, does your role, does your work match our definition of an employment counselor? 74 indicated they did not. And so that reduced our definition of sort of this employment counselor population to 353 people. But wait, there's more. So we've already lost 74. The second problem is, for any of you that have worked for the state or fill out things for the state, before we collect any data from you, you have to fill out what we call a Tennyson warning form. So the Tennyson warning essentially tells you what we're collecting, why we're collecting it, what we're going to do with it. It assures you that you don't need to provide any of it to us. But we also then have to tell you, if you don't provide it to us, if there is something, a negative consequence that might occur because of that, we need to tell you what that is. So we crafted an online Tennyson warning form, and we sent that out to everyone. So the 427. The first question on that online form was our definition. So that got rid of 74. Then the remaining 353 had the option to read through our Tennyson warning and click a button that said, I have read this, and then they had to choose whether or not they wanted to participate. 163, or 46% of that 353 agreed to participate. At that point then, we have at BEAD a telephone survey vendor on contract called Issues and Answers. So we took that list of 163 and we sent it to Issues and Answers. But with that, we sent to them, we confirmed, we had the participants confirm their phone number and their email address, because Issues and Answers was going to both mail them a pre-contact letter and call them. And we also had the consent select days of the week and times of the day that they would like to be called, that they'd be most likely to answer the phone. And one reason we did that is because the short time period that we opened up the surveying for. So they began on April 2nd, they ended on April 21st. And that's a very short time frame. We usually like to leave it open at least a month. But we felt because we had collected so much information and given it to Issues and Answers, and all of these participants were very primed. They knew they were going to be called. They consented to participate. They had selected days of the week. Issues and Answer provides them a 1-800 number. They could call in at any time at their convenience to complete the survey. We crossed our fingers, and we hoped that we would get a high response rate to the survey. Fortunately, we did. 84% of people completed our telephone survey, which, given the time frame and everything, I'd say was a good result. So 137 out of 163. And I wish I could stop on that bragging note, but I feel professionally compelled and responsible to say that that is only 39% of the 353 people. And that 353 people is sort of our created definition of this population, that we really, I suppose we could try to validate it, but it would take a lot of time and effort to reach out to all those programs and agencies. So the data that I'm going to show you related to this part of the survey, it is not generalizable to any of these groups or any of the regions that we break it down into. But this is more of a first attempt to collect this data. Everything that we collected, the only thing we really had about these topics was anecdote. So this was more data to feed into the conversation. I just want to make that clear. We make it clear on the website and the documents, so I just want to make it clear here today too. The other thing about the results that we collected, so you can see a breakdown here by the three groups that Ellen discussed earlier. Dislocated worker was about on par in terms of the ratio of the original population to responses, but we adult was sort of oversampled at the expense of adult workforce development. So, something to keep in mind. The survey asked questions on a wide variety of topics, so program outreach and intake processes, priorities and practices of the program or agency, and then it also delved into questions about what makes a participant a good candidate for training and what types of barriers do participants face when they're looking for employment or they're trying to enroll in training. The survey was 15 questions long, and it was a mix of open and closed-ended questions. So I'll just take you through a few high-level results to highlight them. So the first question that we asked of the counselors was about their formal intake process, because it isn't standardized. Any of these programs or agencies can dictate what their intake process is. So there was no data on essentially what processes are being implemented. So we gave them this list of 4 plus the other. So provide a written application, attend an in-person orientation session, attend a class and or workshop, meet one-on-one with a staff person or other. And as you can see, the majority are in 3 of these categories. So we found that on average, a job seeker that applies to enter into one of these programs is required to meet 3 criteria. We asked this question for 2 reasons. One, again, because it's not mandated in any way that these steps take place, so we wanted to find out what was going on, but also because there's a concern about creaming in the program. And what I mean by creaming is, the concern is the intake process in some way, shape, or form is self-selecting those applicants that are already more likely to succeed on the other end. Right? And so depending on exactly what they're subject to when they apply, it could affect who's able to even be admitted into the program. So beyond these 3 then, the 3 big ones, and attending a class or workshop is rarer. Amongst the other, there were 2 primary criteria. The first were skills-based assessments that participants were subject to, and the second was the provision of official documentation, and that could be anything. It was a pretty broad category. It could be high school transcript, college transcript, vaccination form, or it could be proof of unemployment. We also asked, again with this similar sort of lens towards intake and creaming, whether or not programs worked with applicants with limited English skills. And I really want to emphasize applicants, because we're not talking about participants who are admitted. We are talking about people who are applying to gain entrance into the program. And you can see that it varies quite a bit by region. Overall, about 2/3 say they do work with applicants with limited English skills, but it's concentrated much more in the metro and southern Minnesota. We followed up by asking, what sort of accommodations do you provide? The number 1 answer was, not transcription, interpreter, thank you, interpretation services. But the second one, it has me a little bit concerned about how the question was interpreted, even though we did pre-test it with employment counselors that worked at these. But they talked about referring them to adult basic education or ESL. And I don't know the extent to which that means that they're actually working with the applicant or not. You know, interpretation services are one thing, but referring them to different education, that's another. The survey ended then by focusing again on sort of current policies or practices at the program or agency. And we asked counselors about whether or not their program required them to attend diversity or cultural competency training. And we defined that as, over here, okay, any training which results in an ability to understand, communicate with, and effectively interact with people across cultures. So once they've read that description, we asked them, are you required to attend it? And over half indicated that they are, but those from central and southern Minnesota were less likely to report that it is required of them. Finally, before we had crafted all of this, Ellen and I have been looking at sort of research that's been done by a lot of different groups on these disparities in outcomes for workforce development participants. And we tried to gather together a lot of recommendations that other groups had put forward as a way to solve this. And so we called them potential disparity reduction strategies. And we had the telephone interviewer go through this list with the employment counselors and to rate it as to how high of a priority it is for their program or their agency. So the top 3 are of the highest priority: reaching out to underserved communities, enrolling a diverse group of applicants into the program, and enrolling a diverse group of clients or current participants into training. So those were the 3 of highest priority. The lowest priority, on the other hand, were supporting entrepreneurship among participants of color, let's see, right here, and organizing peer networking groups for women, and organizing peer networking groups for specific racial or cultural groups, which are the two on the bottom here. And there's a few other results that made it onto the What Works web tool. So near the end, I'll also just show you how we use some of that other data. But I'll turn it back over to Ellen for manager interviews.
Yes, so in addition to the data analysis and the survey, we wanted to have more in-depth qualitative conversations with program managers across the state. So we chose 25 managers to reach out to, and the program administration staff here at DEED helped a lot with making sure that we wanted to get a mix of sort of metro and the greater Minnesota region, and we also wanted to speak to different organization types. So within the workforce development sphere, there are sort of organizations that work with WSAs, so it's more inside the system, sort of working with a lot of formula funding. And then there are organizations that don't ever work with formula funding, and their funding is sort of competitively awarded. And so we sort of like see them as more outside the system. And so we wanted to reach both of those types of groups. So yeah, we got 8 managers that work for service areas, 10 at independent agencies. We also spoke to a workforce center manager and a manager at an adult basic education area, and then a pretty even geographic split too. So we asked them questions about common barriers faced by participants, getting at this idea of what works. We asked them for like effective program strategies that stand out to them, and information on context, on successful outcomes sort of not captured by our data and our usual performance metrics. And then we asked them if they see a role and what role that would be for DEED in promoting racial equity. And so here's some of what we found. Again, this is, we use the judgmental sampling technique, so this is not representative necessarily. Our goal was just to sort of collect ideas from the field and share them more widely. And so when we asked them about effective program strategies, I think everyone said intensive case management was like, everyone said that. So that means working one-on-one with people, like providing this navigation service, sort of building relationship with that person. All of that is stuff that we don't see in the data, and so I think it's important to really highlight that that's something going on underneath the data that we see that we don't have a good proxy for. And then I wanted to point out the results for here, what DEED can do to address disparities. Some people didn't have an opinion on what DEED should do. Other people did have an opinion. So 8 people said DEED could do a better job educating employers on hiring and retaining folks with barriers or racial minorities. 7 people said start a conversation around disparities, so sort of bring more awareness to it and just like talk about it more. So that's a pretty vague one, but and then 5 people said examine disparate impact of policies. So this would be like looking at our RFP processes and looking at policies through sort of a racial equity lens. A few people said that. All of these survey results and interview results are written up sort of in just a raw form and available on the website that I'll show you.
Ella,
Yeah.
on 2 slides ago, you said you want to ask them about the barriers. Did you ask specifically about barriers? Because your subsequent slides talk about what can be done. But that's not the same as asking what the barriers are.
Right. Yeah, I'm just not showing the barriers here, but I can show you where it is on the.
Okay.
Yeah. Yeah, we have a similar sort of table of what everyone said, and then the web tool brings in some of that information too, and then the report brings it in too. So we have we're sort of reporting all this stuff in 3 different areas. So we'll clarify that more at the end. So I wanted to pull out quotes too, because those are sort of interesting. I liked this quote because it's sort of the cynical response to someone asking for a dedicated pot of funding. It's like, oh, you want to just throw money at the problem? But I like this quote because it says, like, how throwing money at the problem actually, like, what it changes about the program strategies that they're using and how that actually works at the local level. I like that. So this person talked about through this adult workforce development grant, they had been serving older adults and offenders like throughout their whole history, but with that funding, they sort of had more resources to sort of strengthen their services to those populations. So that was one we pulled out. Obviously, all of this is pretty well. So the other quotes I wanted to pull out that we pull out in the report are sort of getting at what people think DEEP should do. And so one person said, like, I think it's your responsibility to talk to employers about this. And another said that if DEEP could cut through the taboo of hiring someone with an offender or an offense in their background, that would be helpful. A lot of local areas talked about not feeling like they had the political power to start some of those conversations, but that if DEEP could do that from the state level, that would be helpful. So we didn't really evaluate these ideas independently to say, like, oh, is that really feasible? Because we don't necessarily know what's feasible, and that's sort of a longer conversation. A lot of this report is just sharing ideas from the field. So, wanted to show you the Disparities Report. Again, we had the report and the web tool. So for this report, we sort of combine our survey results, results from the interviews, and the analysis of participant data. We also combine that with all of these external recommendations, all of the ones that we found around what DEEP should do about disparities, sort of collected in one place and add to the conversation already occurring at DEEP. And so sort of the 3 themes that we pulled out in the report to highlight was around what DEEP should do to serve people better was serving people of color more intentionally. And this gets back to the idea too of evaluating policies and practices through that racial equity lens, engaging with employers more intentionally around employing individuals with barriers. Quite a few folks said that. And then something I guess we haven't talked about, but which gets to what Scott was mentioning with creaming, was finding performance solutions to serving participants with barriers. So in the report, we talked a bit about what what sort of incentives the program has set up for local areas, and sort of make the point that a lot of energy does go into trying to combat those incentives, and sort of, so this adult workforce development program, for instance, doesn't have the same performance benchmarks that Via Adult has. So Via Adult is federally funded, so we're sort of tied to these performance metrics. Adult workforce development is state funded, so we're able to sort of say that for ourselves. And a lot of local areas said, like, that's how we can serve the hardest to serve, because we're not tied to these performance metrics that really benefit by premium your population. And then finally, we wanted to make the point in the report too that local areas have all approached this very differently from what we saw, especially in the interviews. And that can be a good thing, although it's hard to communicate well from the state level. But I don't know if that was for us. Yeah, so just this idea of allowing local areas to determine that for themselves, like within certain guidelines, I guess. So I do want to show you where the report lives. Yeah, so our communications team worked with us a bunch to put this report online. We have all of the sections there. You can download it in a PDF format if that's your preference. We also include the full methodology and results from the survey and the interviews, because we wanted, again, to just be really like transparent in what we found and what people were saying to us. And we also link to the What Works in Workforce Programs tool, which Scott was instrumental in building, and he will go through that now.
So the tool, in part, was requested of us because it had been talked about at annual conferences of employment counselors. They wanted places to go to both share with each other and just learn more about, what others are doing, if there's any new research in these areas. And so to sort of get at the earlier question about barriers, here's some of the information that we gleaned from manager interviews. So when we asked program managers what strategies are most effective at helping their clients find sustainable living wage employment, one-on-one relationship building, addressing needs seemingly unrelated to employment, such as chemical dependencies or mental health. And then we also supply on many of the pages a place to submit comments. So we are trying to make it a place where employment counselors can come and share things that they're working on, things that have been successful for them. And the report then is broken up sort of by topic here. So with regard to barriers to employment, since that was specifically asked about, I can just review some of the data we put out on this. So when we asked employment counselors and program managers about the employment barriers they commonly see in their work with clients, 43 said a lack of education or credentials, 24 said a lack of means of transportation, and 22% said a lack of childcare or daycare, which to a certain extent is maybe somewhat of the usual suspects. We did have an intern with us as well leading up to this that did a very nice piece on barriers in employment. It's in Trends magazine. Was it the December issue? I can't remember what year it was. It's been a little while now. But Katie, I can't pronounce her last name, Martalier. Okay. but it's definitely worth looking into, because I think that was one of our challenges with barriers, is we didn't want it to be the usual suspects if there was so much more context, which is where the more in-depth results that Ellen had pointed to you come in handy, because we do list them out. So it's not just going to be the top 3. You can't get more detail there. But then as well, what the counselors asked for us were, don't just tell us what the problems are, talk about solutions. So then we did ask, well, what do you do to address the barriers you see? So 31% said connect them to training the participants. 26 said engage them in career counseling and exploration. I'm sorry, 26%. And 19% said refer them to other resources or agencies. But beyond that then, touching on the quotes that Ellen was highlighting, we also did put in quotes wherever they seemed applicable and used it, so the click here to learn about this SAMHSA, to direct people to resources wherever possible. We did, with certain topics as well, with the credential attainment here, we tried to do as much as all those things that I just covered, but then we also provided data from our content management system, which can be filtered, so you can look at low-wage working adults instead of recently laid off workers. You can select education levels. You can select the region of the state that you want to look at. And so just, again, trying to, this transparent way to start discussions about strategies that might help in addressing these disparities.
In your report, do you make any recommendations about specific strategies? If you had to think among that series of strategies, you say focus on these 5 and spend a lot of time on these 2?
No.
Yeah, I did not ask anyone that question. That's a good question.
We also tried to make these a place, again, for ongoing conversation. So beyond just submitting comments, we do have poll charts in here that you can answer. I'll have to remember which one to filter out now. But so if I provide an answer and hit submit, you can see real-time results from other people that have taken the poll. And so one of our intentions with that as well is to make them topic specific, so that in the future, if we wanted to continue to build on these web pages, we could use this as a way to sort of direct us. What should we explore further? What should we add to these pages? And then again, in terms of quotes, we try as much as possible, again, these advice from the field sections. So what did counselors like you, or what did program managers that you potentially work with, they may have participated, what do they have to say about these topics?
Is there any plan to replicate this 5 years from now and see if you get to
Not that we've explicitly talked about. We are starting down a new path. Ellen had mentioned earlier in one of her tables that one thing we heard about was educating employers. And so that's our next step, is we're currently starting a project where we're going to talk to employers about diversifying their workforce. We're trying to locate like case studies, employers that have tried and succeeded, and to share their success with other employers to try to work on both. So we're not just working on workforce development side, we're also trying to address it on the employer side of the equation as well.
I'd also add that I think since this study, since the work you guys did, and the other conversations that are being had around the state and with some of the foundations and government, there looks to be tools that are being brought online, whether it be through DEED or DEED in partnership with others, that are going to be able to do this more systematically each year and over time. So some of this good work hopefully will be seen through the shared metrics conversations that we're having, and then it will be just sort of part of the data that is always available, would be my hope. And I think it's on its way. We're hoping that it's there.
Did you, in the course of doing this study, did you develop hunches about some things that were important that you didn't know how to get at?
I don't know that it was so much that, but there were times when we identified issues that we thought were really important that were really hard to address. So like creaming, for example. We struggled a lot with, do you ask a direct question that could potentially shut someone down and then you lose the opportunity, or do you try to get at it sort of piecemeal? We had long, winding conversations about issues like that, but I don't know, I mean, is there a topic?
I mean, this is not a great, like, research discovery, but going through this process and, like, talking to program managers throughout the state, I was just, like, really impressed at all this work that was going on that people at DEED headquarters don't necessarily hear about. So that sort of, it's, I guess, to me, that in itself is a good reason to have this report, is to just spread these things more widely.
The reason I asked the question is because I'm involved in the Civic Caucus work for the last year or two on workforce preparation and also on human capital challenges facing Minnesota. And we've had quite a few employers come by to talk about the challenges that they face when they engage new employees who simply don't know certain things or don't know how to behave in certain ways or have trouble communicating. One boss told me he hired a woman who was a graduate of our local university who didn't know how to talk on the telephone. I mean, there's a whole array of kind of subtle things that are obstacles or barriers to people smoothly entering into a work situation because it's an alien world and they may have a degree or a certificate or certain kinds of job experiences that didn't involve them interacting with other people. They could just do the work and get paid to go home. But when they enter into other kinds of work, it's clear that their certificate or their degree or their prior work, and it's not something that you would identify by slicing people by, did they participate, did they complete the program, are they Indian, are they this or are they that. It's another category of attitudinal and behavioral things. We start here at 8 o'clock, so someone comes in at 8:15 and wonders why the boss takes exception to that. I don't know what that category of attitudes and attributes is, but it's there. It's a handicap.
We heard from employment counselors, and they talked about soft skills, is what they often call it.
Okay.
Yep. And some of them did mention that as part of the barriers and what they do to address it. It wasn't a common enough response that it ended up making it on things like this, but it is in the results that we posted.
It is, okay.
In the first part of today's talk, you presented a lot of results, cross-sectional results by race group, education group, other things. And Ellen stated that you were not presenting and maybe have not done multivariate analysis to piece apart how much of the racial disparity could actually be explained by other factors. Why not do that? You have education available to you, English ability, vehicle availability, program services offered.
I think we're relying a lot on the net impact work to do that. So the Governor's Workforce Development Council piloted sort of a methodology that workforce professionals sort of agree on. I mean, it's a lot to put yourself out there and just like run a regression and stand by it for people like us who have master's degrees and not much else beyond that. And yeah, so I think we're relying on that impact methodology, and that is another thing that will make its way onto this tool once we have a result in the next year. So that'll be able to get at like how much of this is attributable to race itself and how much is education.
Well, I think we're at 1, so thank you for coming.